disease is the leading cause of death for both men and women around the world. We usually think of medicine or surgery as the way to control it, but our next guest says we can do better by actually working to reverse the disease. Here to tell us how, welcome cardiologist Dr. Mohammed Shalaby from the Texas Heart Institute. Hi. I should say hi again. The problem with this being the #1 killer around the world, and part of that is because most of us don't realize we even have it. There's
That's
that,
right.
you know, Bob was walking around one day and suddenly had a heart attack. Yeah. The body doesn't think it was suddenly.
No. Now, we have around 1.2 million heart attacks a year, but as a matter of fact, we have 140 million people with cardiovascular disease in this nation alone.
Wow.
And most of this population is not diagnosed, and we can only reach to the tip of the iceberg, as we said.
Now, are they not diagnosed because they haven't gone in to get a physical, or were they misdiagnosed?
Most of the time, it's lack of awareness. Especially, we have certain population that we traditionally have missed because we think they're too healthy to have heart disease. They present in a little atypical way. So women, and enough was said about that, but if I screen any group of women, and this was done multiple times, about their #1 health concern, they will say breast cancer.
Yeah.
And what was your last interaction with the healthcare system was a mammogram. Now, if you go to the reality is one of every 26 women will die of breast cancer. Meanwhile, one of every 2 women will die from cardiovascular disease.
Wow.
And it's the #1 killer for women as well as
but we
men.
still think it's a man's disease.
We still think it is as men's disease. We don't, and women have the tendency to present in a little different way from men, so their symptoms are not as aggressive. It's not the elephant sitting in the middle of my chest. They present a little different way with dizziness, with fatigue, with palpitations, more than men.
The other population we miss are young people, athletes, because you think an athlete's got the healthiest heart out there.
Immune,
But tells us a couple of different things. One is heart disease can come from what we do to ourselves. We certainly know that nutrition and obesity can certainly add to heart disease.
Definitely.
But there's another component is just genetics.
Genetics are there, but even if you have a family history of coronary heart disease, and we can identify that early on and put you on a track that we reverse the existing heart disease you do much, much better than if we wait until you have a full-blown coronary artery disease and we start reversing it with surgery or pills.
So the key is to know where you stand. So early detection. There's a number of ways that you can look at things that tell you what's going on inside the body with the heart. Blood work is one.
Blood work is one. And now we are enjoying much better diagnostic abilities than we did 10 years ago. So we have newer testing like a CRP. We have the cholesterol in a much more sophisticated way. And we have the most important factor in early diagnosis is to sit with a medical provider to do what we call a risk stratification. Where do you, in this spectrum of heart disease, are you high risk, intermediate risk, or low risk? That's based on your other medical history, your family history, your level of activity, your level of stress, very important.
Your overall health.
Your overall health.
So you also have CT calcium scoring, MRI, nuclear stress test. You can also look inside of the heart and see what's going on with our arteries and things.
We can. And we have very, very simple technologies that's not invasive and cost efficient, where we can look at the calcium deposit in the coronary arteries. We can look at plaque formation inside the blood vessels. Nuclear is a much more sophisticated way of looking at the actual amount of blood flowing to the heart muscle before and after exercise. Same for MRI. Cardiac PET scan, we have tons of technology now that we are underutilizing to reach early on to the people at risk of heart disease.
Because at least you can know. And now that you know, you can reverse it. And I think, again, we always think, give me a pill to help me maintain it. Don't maintain it, get rid of it. When we reverse it, what does it take? It's not something that's like crazy, is it? It's just it's what we all should be doing anyway?
Very much. I mean, now, by the time you are in the emergency department having a heart attack or having a blockage, that means we have failed on multiple levels to prevent you from going there.
Especially the preventive phase.
The preventive phase, yes. And we always looked at lifestyle modification as a way to prevent heart disease, but now we have a different look at it. It is a way to cure heart disease. Even if you already developed the blockage, if you already have blockages in multiple areas of your vascular system, if you implement a very good diet program, and if we go back to the American Heart Association or Harvard School of Public Health, you'll find that they have insisted that your diet to be on the right track have to be 60% fruits and vegetables, then 20% of healthy proteins and 20% of whole grains. Now, this is one thing. exercise, 30 minutes of exercise every day for 5 days a week will decrease your chance of a heart attack by 50%. That's much better than any surgery.
Or any medicine, really.
Or anything that we came up with for that. Now, we go to new things, though, that the supplements that we have researched very vigorously over the last 20 years. Now, fish oil, for example, as simple as it is, can decrease your chance of a stroke or a heart attack if you take around 3 grams a day by 40 to 50%.
Wow.
And again, that's it. Now, vitamins are very useful, even though it was not proved in a large-scale study, but it doesn't mean that this is very
right, because that can help your overall body.
Exactly, and help the absorption of all the other things.
I think what you said there, doctor, was food is thy medicine, but the right food.
And exercise.
And exercise. All right. See, I was trying to just do food, but he threw in the exercise. Yeah, and exercise. You're right. For more information, you can call Dr. Shalaby at 281-956-7070, 281-956-7070, or log on to drshalaby.com. I just want to make clear that when you have that heart scan, you'll know at least where you stand, so you can either reverse it or know that you don't have a problem, because every now and then someone walks in and you're fine.